Welcome to this afternoon's webinar, Clean Up Our Air, where we'll be discussing the problems and unequal impacts of air pollution, as well as the positive interventions that are being made by campaigners, policymakers, and lawyers. My name is Shaza Yamin, and I'm a partner in the Consumer Law and Product Safety team at Leigh. I work on the group claims that are being brought against Volkswagen and Mercedes in the wake of the diesel emission scandal. My work has highlighted to me how vital clean air is for all of us and how often it is taken for granted by so many. We have four brilliant speakers with us this afternoon. First, we'll hear from Dr. Anant Patel, a consultant physician and clinical lead for respiratory medicine at the Royal Free Hospital and Cleveland Clinic London, with a specialist interest in lung cancer. Anant is passionate about improving the air we all breathe and is an active member of Medicat, advocating for their Health for a Green New Deal campaign. He recently won the 2021 London Public Sector Changemaker of the Year award for his work on educating patients and healthcare colleagues on the health effects of air pollution. He also won the 2019 Royal Free's Clinician of the Year award. Next, we'll hear from Nyeleti Brauer-Maxaeia, a sixth form student and co-founder of the group Choked Up, which campaigns to enshrine the right to breathe clean air in UK law and bring air pollution limits in line with the WHO guidelines. As Black and brown teenagers, Choked Up aim to amplify marginalised voices within the environmental movement. To date, Choked Up have completed a campaign raising the profile of air quality in the 2021 mayoral elections. Dr. Joe Barnes from the University of the West of England will be our third speaker. Joe is a senior research fellow in the Air Quality Management Resource Centre at UWE, with 17 years research experience in air quality management, policy and practice at a local, national, European and international levels. Her main research interest is urban air pollution, particularly road traffic related, helping to understand and raise awareness of the health and environmental justice issues relating to local air pollution and urban stresses to shape and influence policies that improve public health. Finally, Leigh Rowan Smith will discuss how legal interventions can improve air quality. Rowan is a public lawyer in our Human Rights Department with a broad environmental practice. He regularly acts for campaigning and community groups and a number of established NGOs. He has an established reputation as a leading climate change litigator, bringing judicial reviews against the Heathrow Airport expansion, as well as a UK's emission trading scheme. There will be time at the end of the webinar for questions. Some quick housekeeping before we begin. Firstly, please note that your cameras are turned off and that your mics have been muted. You are able to submit questions via the question and answer box on the Zoom toolbar. The webinar is being recorded and will be accessible after the event. Thank you. Over to you, Dr. Patel.
Thank you, Shaza. A pleasure to be with you, and thank you for inviting me. Thank you for Medac to making the connection. I'll just share my screen. And if somebody can let me know when you can see it, please.
Yep, that's there. Thank you.
Super. Thank you. So I'm just going to spend the next 10 minutes setting the scene really about really how hazardous air pollution is to human health. I've got quite a lot to get through, so I'm going to be reasonably quick, but very happy to take any questions at the end of the session. And I think the more challenging the questions, the better, because actually there's going to be a lot of other people outside of the kind of motivated group that logs onto a webinar like this that will come up with really challenging questions and objections to what we think has to happen. This is setting the scene. Many of you will know this image of called Earthrise. The first time the Earth was really seen from a very long distance away by Apollo 8, taken in 1968, the beginning of the environmental movement, really sets the scene as to how fragile our planet is. Even though, you know, our global perspective has been one of an indestructible planet, actually we live in an incredibly fragile ecosystem. And that ecosystem has been really changed rapidly over the last few decades by human behavior. And as you can see, the global surface temperature has really risen quite markedly from, you know, people take 1990 as a base level, but we can see really from about 1970 onwards, a really sustained trend, upward trend in terms of air temperature. And the reason I'm talking about temperature is because it really does link in with heat waves, weather events, and air pollution as well. And in particular, times of high temperature make air pollution much more hazardous to human health. Both, and there's a list here of dehydration, worsening kidney function, skin cancers in the sun, tropical infections with mosquitoes and other type of infectious insults that we're not used to in countries like ours, complications of pregnancy, but really in terms of the big hitters of people that die and are disabled due to air pollution, it's the cardiovascular and respiratory systems that really take the biggest hit, because obviously air pollution is breathed in through the lungs and that bloodstream goes immediately to the heart, to the blood vessels and to the brain. And so strokes, heart attacks, and elements of lung disease are really the big issues when it comes to human health problems. This includes children whose lung function is impaired by about 14% when people are when children are exposed to high levels of air pollution, older populations who are more vulnerable. And of course, people of ethnic minorities and people in poorer communities are much more exposed to air pollution. They often live in denser communities, often working and living at the roadside. And that's true in London as it is across the world. And so this is just an infographic about how temperature and different aspects of air pollution particles interact with each other in order to make health effects worse, particularly in the context of allergic responses and then worsening flare-ups of long-term lung conditions like asthma and COPD. Clean air is a human right, and unfortunately, more than 90% of the world's population, 86% of all children are exposed to toxic levels of air pollution, which are above the WHO limit of 10 micrograms per meter of this particular particle type size. It's known as PM2.5 particulate matter, which is less than 2.5 microns in its diameter and its width. And to put that into context, that's really an incredibly small fraction of a human hair. These are particles that we cannot see, that we cannot smell, that we cannot detect, but we are all breathing in pretty much all the time in an urban environment. The UK's legal limit is of 25 micrograms per meter, way above the WHO's level. The science tells us that actually there's no real safe limit, but less is obviously safer. But the UK is, just to set it into a legal context, that the UK's legal limit is much higher than the recommended WHO limit of 10 micrograms per meter cubed. So thinking about particulate matter, which is very small, often it comes from burning of fossil fuels in terms of road transport, industrial complexes, but actually even in urban environments, wood burners are a huge source of these types of particles. They get into the lungs, into the bloodstream, and these are particles that get into every single cell of the human body. And the impact of those is relatively, is becoming better understood all the time, but not completely understood at the moment. But we know from epidemiological studies, rates of heart disease, heart failure, strokes, lung cancer, chronic lung diseases like asthma and COPD, dementia, all of these things are really adversely affected by the more higher levels of PM2.5. It's not the only thing. It's one of the things that we can measure, and I've got a little monitor that I can measure that with, but it's not the only thing. Nitrogen oxides are incredibly difficult to detect on a kind of day-to-day level, but we know that near the roadside is a huge level of nitric oxides. And this is really part of the major problem with what affects exacerbations of lung disease, ammonia, particularly from farming and agriculture. And so things like choices of what we choose to eat and drink has a massive impact on the amount of ammonia that is produced from where we buy our food and drink from, and sulfur dioxide, particularly from energy generation, particularly from industrial combustion, but also from a domestic setting. MedAct have this really great phrase that we must prevent what we cannot cure. And we're really terrible at doing that. We are very reactive rather than being proactive. And unfortunately, that's led across the world to millions of people dying as a direct result of air pollution every year. In the UK, that number is thought to be somewhere between 35 and 40,000 people per year. In London, 10,000 people per year are thought to die as a result of this. The major issue is that as healthcare professionals, we find it difficult to pick out air pollution as a risk factor for some of these diseases, heart disease, asthma, etc., in the context of infections, in the context of smoking, in the context of alcohol use, in the context of obesity. And we're not always sure on an individual level what air pollution is doing to an individual, but we know from the figures that this does impact people on a huge scale. And you can see in the most densely populated and most polluted parts of the world, in India and China in particular, that those rates of death are highest. And there's an absolute explosion of women, particularly younger women in their 30s, 40s, and 50s, who are developing lung cancer who have never smoked, let alone long-term lung diseases. Outdoor air pollution is really what we've been talking about so far, but bear in mind that indoor air pollution or household air pollution is a big problem worldwide as well. It's less of an issue in the UK, but it's still something of an issue. And we can talk about potentially that as well. I'll gloss over that. So this is a heat map of really of nitrogen dioxide levels. And you can see that really this follows at the roadside. These is often from diesel emissions at the roadside. And this is data from 2016 across the main arterial routes around London. And you can see the North Circular, South Circular, the areas in the middle of the city and around Heathrow Airport to the west of the city. And as I said, air pollutants can go into every single part of our body and do go into every single part of our body. Those that are most highly exposed are people that spend more time at the roadside. And if you're lower down physically in height at the roadside, kids who are 3 and 4 years old are really directly in the firing line of vehicle exhaust fumes. Babies in prams are directly in line. So if you've got young children, pick them up and carry them either on your shoulders or up in your arms and get them out of that. The closer you are to the curbside compared to next to the buildings, levels of air pollution are higher there. Standard face masks, unfortunately, do not protect us against air pollution. But we've seen what it could be like. And we've noticed this in places across the world, that during periods of lockdown due to the COVID-19 pandemic, that our cities were completely transformed and cleaned up, that people could see mountain ranges that they'd never seen in their lifetimes before because the air was just cleaner. My colleague, James Brown, cycles to work every day, very on brand. And during the kind of towards the end of lockdown in May of 2020, took this picture on the left where you could see the skyline beautifully clearly. And he stopped and took a picture because he'd never seen it before on his commute in any clear way. And as time went on and life went back to normal, within a few weeks in June, the skyline was completely obliterated again. And we know, again, from epidemiology that across Europe, at least, and in particular in the UK, about almost 1,800 people survived that otherwise would have died because of less air pollution during a period of lockdown. And in terms of the COVID-19 pandemic, having high levels of air pollution exposure really does put people at much higher risk of dying from COVID-19. And this is a study conducted across all 3,000 plus counties of the United States, showing that the people that were in the 40% of most polluted counties had double the rate of death of COVID-19 adjusted for everything else. So air pollution plays a huge role. And this might be one of the reasons, for example, why people from an ethnic minority background who are more likely to live in more polluted, densely populated areas may have suffered more. And it's true in England as it is in the United States as well. And in particular, PM2.5, PM10s are associated with that. I'm gonna probably finish off with a message about this beautiful young girl who unfortunately died several years ago, aged 9. Her name is Ella Adu Kissy Deborah. Her mum Rosamond, you can see in the bottom right there. And she was a child who unfortunately died from severe asthma. And her episodes of hospitalization, of intensive care, of being on a ventilator in South London were really closely correlated with spikes of air pollution. And she lived literally yards from the South Circular, a road that I used to drive down around the time when she was alive in my petrol car. And unwittingly contributing to the toxic air that she was breathing in. I didn't understand. I'd never had any training or discussion about air pollution. I'd never been instructed to take an air pollution history when I saw a young asthmatic in a hospital environment. That hopefully now is changing. After her case, she's the first person on the planet on her medical cause of death certificate to have air pollution listed as a cause of death. And despite the fact that we know that it kills millions of people across the world, actually it's not recognized in the same way. And actually her case and her mum's campaigning has led to hopefully what will now be a sea change of understanding and of recognition of the damage that air pollution can do. So we must prevent what we cannot cure. Thank you.
Thank you very much. That was very informative and helped set the scene. Next up, Nyeleti.
Hello, thank you for having me speak today. I'm just going to share my screen. Can you see that? So hello, my name is Nyeleti and I'm a co-founder of the campaign Choked Up. So we are a group of young Black and brown teenagers, all from South London, who are campaigning for better air quality, and especially in the most vulnerable communities, deprived and Black and brown communities, which tend to be worst affected, not just by air pollution, but also by the climate crisis on a wider scale. The effects of the climate crisis are seen on a macro level globally, and on a micro level locally in London, to affect people of Black and brown heritage more severely. On a macro level, in the global south, there are more freak weather events that have been happening recently. And in London, we've seen air pollution really have Black and brown people at the front lines of taking the effects of that. Our ultimate goal is to enshrine the right to breathe clean air in UK law. This could be either through a new Clean Air Act or a stronger environment bill. As a campaign, we see the legal or legislative route as the most effective and efficient way to get fast and widespread change, which really does need to happen immediately, as air pollution is claiming far too many lives at the moment, and it's not getting the recognition it deserves. And our campaign started because we all have lived experience of the really terrible effects of air pollution, be that family members who have had to be in and out of hospital because of air pollution, or growing up in the same area as Ella Adu Kissy Deborah, who was the first person to have air pollution as a significant cause of death on her death certificate. It's really been a personal matter for us, and really for everyone living in London. Air pollution is a constant worry and it needs to be more taken account of. So today we have done a direct action in which we put up road signs, which I'm not sure if you can see, but they say pollution zone. And that's really just to highlight both to people in their cars and also to passers-by that air pollution is a very serious issue. It's really everywhere in London. Like, we put them up around Whitechapel and some in Bengali, so that the local community who primarily speak Bengali could also just really be made aware of how intrinsic and damaging air pollution is. This was also part of the wider Mayor for Clean Air 2021 campaign, which was in the run-up to the mayoral elections in London. And we worked alongside MedAct as well, and other groups like Environmental Defence Fund, to really amplify the message of how there needs to be stronger clean air legislation that is in line with WHO targets. We're currently also part of the Stop the Silvertown Tunnel campaign, which is in response to the ongoing project to build the Silvertown Tunnel, which will, introduce a lot of air pollution to an area that is already quite heavily burdened with poor air quality. And we're hoping to also go to COP26 and really get to the root and get to where change can happen in order to just get air pollution more on the agenda and more a priority that it needs to be. So from starting this campaign and really delving into air pollution and its effects, I've learnt how important it is to engage with environmental issues, not simply through the lens of the environment and nature, but also on a social level, and how the effects of the climate crisis have people at the front lines and have had people at the front lines for very long, who haven't necessarily had their voices heard. And it's really been nice to hear that people are, in London at least, people are willing to listen to what we have to say, and to recognise the disproportionate effects, and to be given platforms like this. It makes us really grateful for all of that. And I've also learned that like building alliances and getting closer to decision makers, and even like emailing local MPs and stuff to really make it clear that air pollution is an important issue for the electorate. Yeah, it's been really important in highlighting that this issue needs to be dealt with really quickly. So to help our campaign and to help improve air quality in the UK and push it up the agenda, we would be really grateful if you could support BIPOC voices in general, just because clearly as shown by the environmental crisis and all the issues that are linked to that, like housing and discrimination and all of that, we think that the environmental movement definitely needs the voices of those who are affected first to be amplified. The environmental working sector has quite a reputation for being very white and middle class, and this simply just doesn't centre the people who are affected first. I think there was a study actually done recently that showed that the environmental sector is the second whitest sector for working in the UK after farming, which is, it's just not really good enough, and it's not possible that that a good solution and a solution that takes everybody into account for air pollution and the climate crisis can be reached without those who are being affected first being at the front lines. So please get in touch with us if you can help us, or if we can help you, and we're really keen to collaborate with people and decision makers, lawmakers. We really admire the work that Leigh has done in furthering air quality, safety and stuff. So yeah, thank you so much for listening, and have a nice day.
Thank you very much. That was very informative. Just a reminder to everybody that if you want to ask any questions, we have a Q&A session, so please do type your question into the box and it will come up at the end. Nyeleti unfortunately has to leave at 1:40, so if you have any questions for her, please can you send those through before then. Next up, we also have Dr. Jo Bond speaking.
Thank you very much, Shaza. Let me just share my screen with you. Okay, hopefully you can see that okay now. Brilliant. Okay. Well, first of all, thank you very much for the invitation to speak on the subject of environmental justice and air pollution. To start off with, just to recap on those numbers of deaths that Dr. Patel talked about earlier, we know that air quality is the largest environmental health risk in the UK, and we have between 28,000 and 36,000 people each year dying prematurely as a result of exposure to air pollution in the UK. But it's not just about the deaths. We also have significant costs associated with exposure to air pollution in terms of healthcare through the NHS and in social care. So it's a significant mortality, but also a significant morbidity issue. And this graphic really just shows you how proportionally the number of people that are subject to the health impacts of air pollution or having to live with the health effects of air pollution clearly outweighs the number of people who are dying from air pollution. So people having to live with the consequences of air pollution, it's affecting their health quite considerably. And as Dr. Patel suggested also, that there are different health effects throughout people's lifetimes as well, from low birth rates associated with pregnant mothers being exposed to air pollution, through to children who are more susceptible to the effects of air pollution because they are developing lungs, and it can also lead to developmental problems, neurological problems, through to in adulthood, where we start to experience the cumulative effects of being exposed to air pollution over our lifetimes, leading to things like stroke and lung cancer and COPD. And then in older age as well, where we have the accumulation of exposure throughout people's lifetimes added to the susceptibility of our bodies becoming weaker and more susceptible to those impacts as well. So there are different groups who we can consider to be vulnerable or susceptible groups, and we've identified pregnant women, children, and older people there, and also those that also have pre-existing cardiovascular and respiratory disease, but also those people that are living in communities with poor air quality, particularly those that are close to main roads, who tend to be in groups that are of low socioeconomic status. And as Jarrett et al. Identified, groups of people that are living in low socioeconomic status are also subject to the health conditions that are associated with having that low socioeconomic status. If they are also exposed to high air pollution, then you've got that combined impact. But if you also think about the susceptibility of particular groups, as we've mentioned, pregnant women, children, the elderly, etc., and those with pre-existing conditions, you could end up looking at this in terms of having a quadruple jeopardy effect as another level of insult. Now, to move on to some research in the area. So not a lot of research has been done on, in a UK context at any rate. There's been a lot of work in the US, but not a lot of work in the UK on air pollution exposure and ethnicity. But this work from Imperial a few years ago did look at deprivation, ethnicity, and the proportion of different vulnerable groups associated with exposure to pollutants, particulate matter, and nitrogen dioxide, and found that we have higher concentrations in those areas that have the most, the highest proportions of deprivation, but also in those neighbourhoods with the higher proportions of non-white residents as well. So air pollution is associated with deprivation and ethnicity as well in that context. It also concluded that air pollution inequalities were actually associated with urban, and was an urban problem predominantly, and therefore we need to focus on urban areas and particularly on city transport in order to be able to remediate that. Some research done by Hugh Brunt through his PhD with us when he was working for Public Health Wales looked at the combination of exposure to air pollution and deprivation status and looked at the health impacts associated with that, and actually found that it was more than an additive effect. We actually had a multiplicative effect of exposure to air pollution and deprivation were actually having worsening effects on air pollution when you look at those in combination. And some of my own research with colleagues in the Air Quality Management Resource Centre at UWE has confirmed that the areas with a higher proportion of households in poverty are exposed to higher concentrations of, in this case, road traffic pollution, nitrogen dioxide. But there's a significant environmental justice issue. If you look at the graph on the right-hand side here, which shows that they are not the ones that are contributing in terms of private vehicle emissions. So they're exposed to air pollution, but they're not the ones that are contributing most to it. And if we unpick that a little bit more, we can see that's because areas with a high proportion of households in poverty are more likely to not own a car in the first place. They are certainly less likely to own multiple cars, as the graph on the right shows. They are also less likely to own a diesel vehicle, and we know diesel vehicles are significantly more contributing to traffic pollution. And also they are less likely to travel significant distances as well. So the combination of all of those factors has meant that there's a significant environmental justice issue. And I've just broken that down by bullet points here. So you can see that what I'm saying is households in poverty have, they have lower private vehicle household emissions. So they're producing less air pollution from road traffic. They have less chance of owning a car, or they're less likely to own a car, less likely to own multiple cars, etc. But they are exposed to the highest levels of air pollution. So And there's some evidence to suggest that these inequalities are actually increasing. So this is research from a few years ago from Mitchell et al., which was looking at changes in air pollution from 2001 to 2011, looking at census data, and shows, if you can see in this graph, that people who are living, the air pollution in terms of nitrogen dioxide concentrations had fallen more in more affluent areas, or in the lowest quartile of deprivations. You can see there under Q1, so nitrogen dioxide concentrations have fallen more in more affluent areas than they had in the more deprived areas under Q5 there. Added to that, when they looked at PM10 concentrations, they found that actually PM10 concentrations had increased, but they'd increased more in the poorer areas. And as Dr. Patel was saying earlier, there are air pollution is also associated with other urban stresses such as heat, urban heat stress, but also noise pollution, as this report from the European Environment Agency that we contributed to a few years ago has outlined. So it's this combined effect when you live in urban areas of exposure to air pollution, exposure to noise, exposure to heat, as well as all of those socioeconomic status issues underpinning. I just want to finish off with some recent work that I've been involved in over this last year, working with the Environment Agency. The Environment Agency, together with Public Health England as was, and DEFRA, have been running a series of workshops to better understand people's lived experiences of inequalities in association with air quality or air pollution. So they've had a series of workshops under different categories such as age, ethnicity, etc., as you can see there. And the results of these workshops are now going to be feeding into a range of cross-Whitehall policy workshops. So these are going to eventually then feed into policy and guidance as well. And the participants in these lived experience workshops have also joined this air quality inequalities network. So the Environment Agency have set up a Slack account and have invited everyone to come and join. And the purpose of the Slack network is really to allow people to build on those workshops and to share resources and to make contacts and to feel like they're being listened to, essentially, and to be listened to. So if you are in that situation, you would like to contribute and you'd like to get your voice heard a little bit more, please do join this Slack, and I can share that Slack link through Leigh Day. So really, just to conclude, air pollution, it has a significant effect on health in terms of mortality, but also quality of life as well. And we have different health impacts throughout our life course. Different groups of people are considered to be more susceptible, more vulnerable. And we also have high levels of association between air pollution and deprivation, socioeconomic status, and ethnic diversity as well. Deprivation and air pollution combined actually have a multiplicative impact on health, and there are significant environmental justice issues with households in poverty, particularly being exposed to more air pollution, but not contributing significantly to it. There are also disparities in how concentrations are improving across the country as well, and in some cases worsening. And as I've said, it's really just part of a bigger mix of health determinants affecting people in lower socioeconomic status. But the positive news is that policymakers are beginning to recognise these issues and are beginning to integrate them into policy. So please join the Air Quality Inequalities Network if you'd like to find out more and to engage with others. Thank you very much.
Thank you very much for that. Just to let you know that, Nyeleti, we've had a few people asking for your details and to collaborate with you. And we will share Nyeleti's details after the event.
Perfect, thank you.
On to our final speaker, Rowan Smith.
Hi, everyone. Just checking. You can see that? Yeah, great. Well, thanks for inviting me to speak. Feel very privileged to be contributing to this talk with the other fantastic speakers. So I'm going to speak briefly about developments in public law litigation on air quality. So I'm a public lawyer, which means that the cases that I take for clients and campaigners are cases against government policy. So that's slightly different to the work of other lawyers like Shaza, where they're bringing cases about damages or compensation, whereas the work I do with colleagues is about often about government policy and establishing whether that policy is lawful. Some of this policy context has been covered already, particularly the statistics of the scale of the problem of air pollution. Perhaps what we've not talked about so far is the government's response to those statistics. One of the key pieces of policy response was the Clean Air Strategy that was published in 2019, recognizing the scale of the issue, and that particularly pollution from road transport contributing to 80% of nitrogen oxides concentrations, which leads into what I'll say in a bit about the new Environment Bill and how that relates to air pollution. So the legal framework surrounding the law on air quality is covered both at a local government level and a national government level. So the Environment Act 1995 established responsibilities on local authorities to draw up what are called air quality management areas, where it was considered that action on air quality was needed, and that those areas would be subject to air quality action plans, and as well as, and that all fed into a national air quality strategy set at national level. This was all then supplemented by the EU Directive on Air Quality. And for today's purposes, we can all assume that the EU law on air quality still applies, because it was passed before Brexit. And as I'll go on to talk about in the next slide, we have our own domestic legislation that implements those rules at an EU level. But essentially, the directive sets limit values past which it says member states can't allow air pollution to deteriorate. And if there are exceedances, then there are certain steps that the UK government is required to take. Something just at the bottom there that I just wanted to flag, because it appears at the EU level, but not necessarily so much at the domestic level, that there's a recognition that air quality plans may need to incorporate specific measures to tackle groups of the population, particularly who are particularly sensitive to air pollution. So 2010, the UK introduces its own air quality standards regulations to effectively implement the EU requirements. Again, with parallel limit values being set and parallel duties set on the Secretary of State. Two regulations are quite important. Regulation 17 is the duty to maintain best ambient air quality compatible with sustainable development, and to maintain levels of pollution below limit values. And then Regulation 16 26 is the important provision about achieving compliance within the shortest possible time, and that phrase has been contested in legal cases, which I'll talk about next. As some of you might be aware, there was a series of cases brought by the NGO ClientEarth, which effectively was groundbreaking in terms of equality litigation in the UK, which started in 2013 and to some extent is still ongoing. But the early case effectively established that there was a deadline under the EU directive that was set at the 1st of January 2010, by which point it was expected that the UK government would have secured compliance with limit values, and obviously it hasn't. There was provision for an extension to that, but only for 5 years. So the government was previously relying on the extension to effectively have an open-ended ability to effectively defer compliance, but the Supreme Court sided with ClientEarth and declared that the UK was in breach of the directive. And then what followed were two more pieces of litigation, and I've just summarised the key points there, so that there was interpretation of the regulations. I mean, compliance should be achieved by the soonest date possible. That second bullet point is quite crucial for thinking about cases that might be brought in the future, because the courts have recognised that duty has a subsidiary duty on the government to adopt policies consistent with that aim. And then following the litigation, there's been the introduction and proliferation of clean air zones, which is the government's response to what the courts ruled. And the next couple of slides, I just wanted to quickly talk about domestic legal developments and also EU legal developments. One case that I was involved in was to do with a planning application where there was a development to build 4,000 new homes, and the campaigners there argued that decision shouldn't be made at a local level, rather it should be made at the national level by the Secretary of State, and asked for the Secretary of State to effectively call in the planning application, make the decision itself, because it was argued that the development would effectively exacerbate existing breaches of limit values. Unfortunately, that argument was rejected, and the court took a very cautious approach to what was required under the directive, effectively saying that the only remedy that you have for air quality breaches at a national level is for the government to set these plans as required by the EU directive. So that obviously was not helpful. But then subsequently, there's been other cases which are possibly more helpful. So I'll just really quickly summarise this case, which was again about housing development. But there the inspector, who was the decision maker, decided that they couldn't be confident that air quality breaches would be dealt with within the shortest time possible. And importantly, the courts of appeal agreed and said that the inspector was entitled to reach that planning judgment. And that's particularly useful for future litigation, because the Court of Appeal recognised that there may well be these national plans, but if there's no guarantee that air quality action will be taken by a specific date and that will translate into local improvements, then effectively local decision makers don't have to defer to that and can reach their own conclusions on air quality. Conscious of the time, I'll just skip through that. and talk about 2 European cases. Crane Nest was a very important development, because that said that previous attempts by governments to say that if air quality is averaged out and is below limit values, then that means that we're compliant with the directive. Whereas Crane Nest says no, that's not correct, and even if even in a single location you have an exceedance, then that's enough to register non-compliance, which obviously is much stricter. And I would have thought that would mean that a number of decisions that have been made may need to be looked at again in light of that decision. And of course, ClientEarth litigation, the ramifications of that still being felt, with the EU Commission bringing infraction proceedings against the UK government for systematically and persistently exceeding limits. And then lastly, on the Environment Bill and its proposed 2 new legally binding targets of annual mean levels of fine particulate matter, and also population exposure, still will be seen what amendments will be made to those proposals, and even when they might be brought in, because as people may be aware, there's been quite a few delays. But importantly, the Lords are showing their teeth and have introduced legally binding interim targets, declaration on biodiversity and climate change emergency, and also the adoption of a target to keep levels equal or below WHO guidelines. But whether that will be voted through in the bill when it goes back to the Commons, we will see. So that ends my presentation. Thanks.
Thank you very much, Rowan. Just some time now for some of the questions that have come in. The first question we have is for Joe. The question is, Joe mentioned that policymakers are aware of inequalities and the impact of air pollution and are addressing that. Can Joe say a little more about how that's being done, in what sectors, and whether it's enough to address the problems?
Okay, possibly it was a slight overstatement, as much as they are starting to take into account inequalities. It is still early days, and I can't give any particular sectors where that's currently happening, but the work that the Environment Agency has been doing alongside Public Health England, and DEFRA in particular, that work where the lived experiences are translating into the policy workshops, and those policy workshops are then going to translate into guidance. That is something which is happening currently. So to say it is already happened, possibly was an overstatement, but it is happening. Okay.
Thank you very much. A further question. A recent report by the Clean Air Fund found that more global aid goes to projects funding fossil fuel than tackling air pollution, which only receives 1% of global aid. What can be done to ensure that air pollution is made a priority in the aid sector? Dr. Patel, did you want to start with that one?
I think probably Joe's much more qualified to answer that question than me. What do you think, Joe?
Not sure.
Shaza, could you repeat the question for me, please?
A recent report by the Clean Air Fund found that more global aid goes to projects funding fossil fuel than tackling air pollution, which only receives 1% of global aid. What can be done to ensure that air pollution is made a priority in the aid sector?
So it's the people, in my limited experience of activism, is that it's the people with the loudest voices and the sharpest elbows that get their ways. And writing to your MP is something that very few of us do in society, and that would be a reasonable place to start. There are parliamentary committees, some of which may be fed into by the work that Jo and her colleagues are doing as well, that can listen to some of these narratives that people have to offer. But essentially, and ultimately in a democracy, it's who you vote for that actually makes a big difference to policy in the long term. And, you know, unfortunately, air pollution is inevitably going to be lower down the agenda than healthcare, for example, or, you know, within the pandemic, or all sorts of other things. And the economics of air pollution really has to be turned into the only thing that really changes a politician's mind, in my view, is money. And so if you can adopt something along the lines of MEDAC's campaign for a Health for a Green New Deal, where you're, as well as having environmental benefit, are creating sustainable and green jobs alongside it and benefiting the economy alongside it, and those two go hand in hand and are inseparable, that's the only way I think of helping things along from an environmental point of view.
Yeah, I would agree with what Anant has said there. I think influencing policy is a big challenge sometimes. Even if you've got a really strong evidence, and you've really got strong evidence of a strong impact, as we've got with air pollution, it's still difficult sometimes to try to get that policy changed. So you have to speak the language, as Dr. Patel's saying. You have to turn it into economic terms, and you have to lobby as hard as the fossil fuel lobby is lobbying, but harder. We don't have the money to be able to do it as they do, but yeah, it's all about how much influence you can garner. So yeah, I would agree with everything you said.
Could I just quickly draw on a case that we're doing that touches upon this? We're currently working with Friends of the Earth to bring a challenge against the UK government's investment in a liquefied natural gas project off the coast of Mozambique. And that challenge was brought because we identified that the Department of International Trade was investing in these fossil fuel projects. So that might be another potential legal solution where you can identify that these projects are both damaging to the climate and to the environment generally on air pollution grounds. That there are sustainable development duties on the UK government, even when it spends foreign aid, to spend that in a way that doesn't that's consistent with sustainable development.
Thank you, Rowan. And thank you, panel. Okay, I think that's the end of the event. We've run out of time, sadly. Does anybody have any closing remarks or anything they want to add? Thank you. Thank you very much for attending. The recording will be available in due course, and don't forget to follow us on our social media accounts to stay updated on this and future events.